So, the complications of diabetes mellitus. Is the screen visible now?
Yes, ma'am.
Is the screen visible?
Yes, ma'am.
Okay. So, acute and chronic complications of diabetes mellitus. So we were discussing about diabetes mellitus. What are the metabolic derangements which happens in diabetes mellitus? And basically, though we know that it is a complication with either the production of insulin or because of autoimmune breakdown of the pancreatic beta cells in the production of insulin, or because of your body is not sensitive enough towards the insulin. There are many factors which can actually contribute to diabetes mellitus, but if not controlled, if not diagnosed earlier, and if not necessary, steps are taken in order to prevent the progression of the disease. So that is very important. So first thing is you diagnose the disease. So as we had discussed earlier also, in diabetes, the main problem is, you are not able to understand whether you have a hyperglycemia, maybe until it reaches a particular level. So that varies with patient to patient. So once you identify, you have to take the necessary steps so that the disease does not progress to a worse level. Okay. So today we are going to discuss about the acute and chronic complications of diabetes mellitus. Now, acute complications include diabetic ketoacidosis, hyperosmolar hyperglycemic non-ketotic coma, and hypoglycemia. Okay, so these are the three complications which are acute complications. Now coming to chronic complications. Okay, chronic hyperglycemia is central to the pathophysiology of chronic complications. Which are the chronic complications? Cardiovascular and peripheral vascular diseases, retinopathy, nephropathy, and neuropathy. So these are the other diseases which are called as chronic complications. So let us go into the details as to what is the difference between these acute complications and chronic complications. So over time, the surge and crash of dissolved glucose and insulin that occurs in the diabetes can end up causing irreparable damage to many body organs of the system. So if you're not taking control, it can actually lead to complications to different organs. Okay. So doctors refers to this as end organ damage because it can affect nearly every organ system in the body. So that is the reason why doctors say that once you diagnose diabetes, you will have to manage diabetes so that the disease is not progressing beyond a certain level where it could lead to acute and chronic complications of diabetes. Now, one of the complications is hypertension, which could also lead to heart diseases or cardiovascular diseases. And hypertension is almost uniformly found in people with type 2 diabetes. So as the blood glucose level increases, our bodies attempt to use various means to lower the concentration of glucose back to normal level. So whenever your body is having a high level of glucose, the body itself is trying to adjust so that you bring down the glucose to normal levels. And one way the body attempts to do this is by holding more fluid in the blood vessels. So this is another way. Okay, so how do you actually reduce the blood glucose or the concentration of the glucose? Like, for example, you are drinking, I think, I don't know whether I mentioned it to you or not. Suppose you have a glass of water and you have added 3 tablespoons of sugar, and for you're preparing lime juice, okay, you have added 3 tablespoons of sugar, and you are dissolving, you have added only half glass of water, and then you try to drink it. Is very, very sweet. How do you reduce the sweetness of this? You add more water. Okay, so you add more water or you increase the volume so that the concentration of the glucose comes down. Same way in our body, when the glucose level goes up, the body tries to reduce the glucose level by increasing the volume. Okay, so as the blood glucose level increases, our body attempts to use various means to lower the concentration of glucose back to normal levels. How? One way the body attempts to do this is by holding more fluid in the blood vessels. So it is trying to hold more fluid in the blood vessels. And this extra fluid causes the pressure in the vessels to increase. So this leads to, because there is, suppose this is so narrow and there was only so much of fluid, suddenly it is trying to hold more fluid, it becomes the pressure develops. Okay, so this extra fluid causes the pressure in the vessels to increase, and heightened blood pressure in turn leads to generalized weakening of the circulatory system. So when there is continuously a lot of pressure in the blood vessels become weak. Okay, so that is and when because of this high blood pressure, so this actually causes, because of the increase in blood volume, it causes hypertension, high blood pressure. This is actually very true, because I know a person who had a heart disease, and after the bypass surgery, the doctor has told not to drink too much of water, because by itself the vessels are weak, and the vessel, and he's diabetic also. So what happens? The body will try to increase the blood volume, okay, the volume there. So if you are trying to increase more of water, so the input of water should be reduced as water has prescribed. So hypertension is another very, very important factor which has to be controlled. And this hypertension can eventually lead to blood vessels bursting in some extreme cases. And this is what is called as vascular stroke. Or it can lead to development of chronic blood flow problems in the limbs and other peripheral parts of the body. Okay, so this is what is leading, it is actually leading to the development of chronic blood flow problems in the limbs, because one of the artery, the vascular stroke, not the artery, the vascular blood vessel, because of the increase in blood pressure, it can actually lead to bursting, and the blood flow can be affected. So chronically high insulin levels are also associated with early development of atherosclerotic plaques inside the blood vessels, which lead to further risk of aneurysm, hypertension, stroke, and heart attack. So these are other repercussions which could be due to the high blood pressure. Next chronic complication or acute complication is eye disease. You must have heard about diabetic patients on the long run. So doctor usually tells them to come and check up at least once in a year for the eye. This is because this could actually affect the retina. Okay, so untreated diabetes can lead to a variety of eye problems, including blindness and reduced vision. So diabetes is the #1 cause of acquired blindness in people under the age of 65, and is one of the leading cause in older adults. So it has been found that the people who are slowly they start losing vision, the vision becomes not blurred or unclear. This could be because of diabetic retinopathy. So people with diabetes experience damage to blood vessels and nerves in the back of the eye, an area which is called as the retina. So this leads to a condition called as diabetic retinopathy. So this is another aftermath of diabetes. So diabetes can also cause abnormally new growth of capillaries inside the retina that degrade blood flow and weaken vision. So that is yet another problem. Other than the retinopathy, other than that, it could also lead to certain abnormal new growth of capillaries inside the retina, which could also lead to weakening of the vision. And once it occurs, so this is another important thing you should realize. Unlike cataract or something like that, which you can actually get back to the normalcy by a surgery, diabetic retinopathy, once the damage is done, it is irreversible. So our aim is to prevent further damage. So continuous monitoring can actually, there are drops which actually, which is to be poured in order to, relax the blood vessels and to help in the progression of retinopathy, in controlling the progression of retinopathy. So once it occurs, damage to vision is permanent. Okay. So when identified early enough, many vision problems associated with diabetes can be repaired or it can be avoided. So individuals with diabetes should have their eyes examined once a year by an eye doctor. So this is very, very important. And people with diabetes can prevent eye problems by keeping their blood glucose under control, lowering their blood pressure and cholesterol levels. So these are other important things, how they can actually prevent eye problems by keeping their blood glucose level under control and by lowering their blood pressure and the cholesterol levels. Now coming to the third one. So we discussed about high blood pressure. Second is eye retinopathy. Next we are discussing about the kidney disease, which is called as nephropathy. So kidney's main job is to filter the blood, and in those with diabetes, as we have discussed, regarding the renal threshold, the amount of glucose in blood rises above 180 milligram per deciliter, the body is not able to filter back the glucose, so the glucose gets eliminated through urine. So continuously, when the blood is being filtered out through the urine, the kidney has to work more, and then it actually damages the blood vessels in the kidney over time. And this process is what is called as diabetic nephropathy. Okay, so in extreme cases, diabetes can lead to kidney failure, necessitating frequent and expensive dialysis. So in such cases, this is what happens. Diabetes can lead to kidney failure, necessitating frequent and expensive dialysis, machine filtration of the blood, or risky, expensive, and difficult to obtain kidney transplantation. So these are the problems which could occur if such things happens. And diabetes is the number one reason where most of the Americans are on dialysis. So whoever is on dialysis, the root cause, majority, if you see 80% is because of diabetes. So doctors test urine of patients with diabetes to monitor for kidney failure. So they usually test the urine in order to find out whether the amount of glucose which is being excreted in the urine, if it is considerably high, if you are not taking necessary precautions, that can lead to damage of the kidney, which is called as nephropathy. Next is what is called as nerve damage or neuropathy, how it is affecting the nerves. So sugar in the blood damages the peripheral nervous system, that part of the nervous system that works the arms, legs, and other extremities. For example, extremities means the tip of the hand, the tip of the leg, or any extremities is the one which is just affecting, because the blood flow is not smooth enough, and affected patients report pain, tingling, or buzzing sensations in their hands and or feet. So this is what is happening. This is one of the symptoms of diabetes. Okay, so patients will start feeling pain, tingling, or buzzing sensations in their hands or feet. And it could also lead to complete numbness or loss of sensation in the limbs. That is also common. Okay, so patients may also lose bladder control and the ability to walk. So this is another problem which could arise. They might lose bladder control because, as we had discussed earlier, in order to eliminate glucose through urine, frequent urination has to occur. And because of the damage to the nerves, the patients lose bladder control also. And males lose ability to function sexually. And this is because impotence or erectile dysfunction may also occur if it is not treated at the earliest. Now coming to joint and foot problems. So poor blood flow in the limbs combined with nerve damage. So you know that there are multiple problems which are leading to such symptoms. So we understood that the blood flow is limited and the nerve is also damaged. We saw that is affecting the vascular system, and reduced or deadened sensation lead to a situation where the extremities, for example, the ends of the feet or the hands, become easily susceptible to damage and disease. And damage to joints also occurs. So caused by lack of ability to feel pain properly. So you don't realize the pain because of the numbness, because of the damage done to the nerves. And sometimes damage is done to the joints also, and ulcers of the feet are also common. So those who are suffering from, those who are highly diabetic, they may not even have a sensation when there is a cut on the leg or things like that, because the nerve is damaged, and because you're not taking care of that, that can also lead to more complications. So foot and limb problems related to diabetics can usually be helped with proper treatment. However, left untreated, wounds can become infected and limbs may require amputation. So these are other problems. Okay. What are the other problems? When it is untreated, wounds can become infected and limbs may require amputation. So this was a common phenomenon maybe about 30-40 years back. Maybe you would have seen also many people who were diabetic, because it was not managed properly, their limbs had to be amputated. But now that is not the cause, because there are diagnostic measures to identify the diabetes at a very early stage and to manage diabetes properly. So it is imperative that those individuals with diabetes perform self-foot exams on a daily basis, and that they undergo a foot exam by a health professional once a year. So once a year, it is better to go and visit the doctor to identify whether you have a high blood pressure. Go to your eye doctor and check whether any damage to the retina or diabetic retinopathy is progressing or not. Then regarding your nerve damage, or not the nerve damage, nephropathy, okay? So you have to consult the urologist and check whether there is a damage to the kidney. Then, of course, the joint and foot problems. Then infections of the skin. So that is not so bad when compared with the other acute complications. So diabetes can cause a number of skin conditions, including fungal and bacterial infections, skin spotting. Okay, this is called as diabetic dermopathy. It is on the skin, spots starts appearing, and a variety of spots, rashes, and bumpy or oddly textured skin patches could occur in patients with diabetes. So most of these conditions are related to chronically raised blood sugar levels. So this happens when your blood sugar level is going to a very high stage. For example, it goes to 300, 400 range, okay, and become less of a problem once blood sugar is brought under control, okay. So you see that one simple blood sugar can lead to so many complications if you are not taking care. So individuals with diabetes are also at increased risk of all types of infection because of impaired immunity. So that is what those who are having diabetes, their immunity level is very low. So what happens once your immunity level is low? You are not able to fight an infection. So if anybody has any flu or viral disease or something who comes close to you, you immediately catches that disease. Okay, so because your immunity level is very low. Okay, so they are at risk to get infection. So it is better not to go and visit a patient who is sick and things like that. So for this reason, it is important for people with diabetes to get annual influenza vaccination and pneumococcal vaccine every 5 years, which is not very prevalent in India, but in Western countries, especially in America, they give an annual flu vaccine and pneumococcal vaccine every year so that they are not prone to such infections also. Other than that is what is called as cognitive issues. Cognitive issue is, as we know that one of the organs most affected by blood sugar fluctuations is the brain, and brain actually depends on sugar for energy. So, okay, so the brain is impacted by diabetes. So chronic uncontrolled diabetes appears to be associated with memory problems and dementia in the elderly, and may increase risk of Alzheimer's disease also. So this could also be in the later stage, this could lead to dementia and Alzheimer's disease. And in younger patients with type 1 diabetes, elevated blood sugar levels were found to be associated with increased difficulty performing mental arithmetic and with decreased verbal fluency performance. Okay. So they were found to have a difficulty in solving mathematical problems, and even the vocabulary. They are not able to grasp more words or to understand the spellings and things like that. They might have find difficulty, not for the type 2 diabetes, it is for the type 1 diabetes. So this slowing of cognitive functions was reversible as sugar levels decrease. So they found that when this happens when the sugar level is at a very high level, but when it is reduced, that comes actually down. So in general, if you see, the complications of diabetes mellitus are many. Acute complications are diabetic ketoacidosis, that we discussed earlier, like, when your carbohydrate metabolism is at a problem, what happens? The body skips into lipid metabolism. And when there is a high rate of lipid metabolism or lipolysis, what happens? There is an increase in acetyl-CoA. When there is an increase in acetyl-CoA is diverted to form ketone bodies, and ketone bodies like beta-hydroxybutyrate, acetoacetate, and acetone gets accumulated. This could lead to diabetic ketoacidosis, leading to coma. Hypoglycemia, we have discussed in detail. Whenever insulin is taken without prescription, and when you skip meals in between immediately after taking insulin, and such complications can lead to hypoglycemia. Diabetic non-ketotic hyperosmolar coma. Okay, so when there is a difference in the electrolyte balance in the body, it is not because of ketosis, but due to other reasons also, it could lead to what is called as hyperosmolar coma. Then you go to chronic complications. Under chronic complications, you can actually classify them as microvascular and macrovascular. Microvascular means small blood vessel, macrovascular is large blood vessels. So in under microvascular are the ones which we discussed just now. For example, retinopathy, which affects the eye, nephropathy, which affects the kidney, neuropathy, which affects the nerves, diabetic food, which can will lead to complications like gangrene. And another problem is, because your blood is full of sugar, whenever a cut is formed, your blood is so, because it is rich in sugar, it is a very rich and medium for microorganisms to thrive. And that is the reason why infections does not get healed, okay, when there is a wound which leads to gangrene or which leads to amputation, because your nerve is also damaged. There is no good blood supply to help in clotting and help in controlling the injury. And we also discussed about the role of insulin actually, in helping in muscle injury by transporting amino acids to the places of injury. So that also is not happening. Okay. And dermopathy, as we discussed about the skin lesions and spotting on the skin. And then the second class, which is called as a macrovascular, under that you have the cerebrovascular, which is happening into the blood vessels of the brain, which could lead to stroke. And cardiovascular, which is affecting the blood vessels, which lead to the heart, which could lead to ischemic heart attack. And of course, peripheral vascular diseases. So in general, we can classify them as acute complications and chronic complications. And in acute complications, we have the diabetic ketoacidosis, hyperglycemic hyperosmolar state, which is a different state unlike your ketosis. Then hypoglycemia, then diabetic foot ulcer and infections, and the chronic complications. Under microvascular, we have retinopathy, nephropathy, and neuropathy. And under macrovascular, we have accelerated atherosclerosis, which means those who are otherwise also you might develop atherosclerosis. Atherosclerosis is nothing but the deposition of plaques in the blood vessels. Okay. That could be because whenever you have a high HDL lipoprotein in your blood also, that could LDL and VLDL also, HDL is good cholesterol. When that ratio is different, that also could lead to that. And if you're taking too much of a fatty diet also, that could lead to that. But when you're diabetic, this process itself the speed is enhanced. That means within a few years itself, there is an accelerated atherosclerosis, myocardial infarction, stroke. These are the other factors or chronic complications. Now, if you look into the entire body itself, you can see that many of the organs are affected because of the major complications of diabetes. So if you classify them as microvascular complications, and you can classify them as macrovascular complications. Under microvascular, the first one which is getting affected is your eye. There is a high blood glucose and high blood pressure can damage the eye blood vessels, causing which all retinopathy, cataract, and glaucoma. Okay. And if you look into the kidney, because of the high blood pressure, it damages the small blood vessels and excess blood glucose. Because of excess blood glucose, what happened? The kidney has to work more, which results in nephropathy. The third one is the neuropathy. Because of hyperglycemia, it damages the nerves in the peripheral nervous system. And this results in pain and numbness. You don't feel it, okay? And feet wounds may go undetected. You are not even clear whether there is a wound or whether the wound has become big or is it infected. You're not getting the sensation, and it gets infected and it leads to gangrene, okay? Now coming to the macrovascular complications, you can see that the brain, it is at an increased risk of stroke and cerebrovascular diseases, including transient ischemic attack and cognitive impairment. If you look at the heart, high blood pressure and insulin resistance can increase the risk of coronary heart disease and extremities, especially it happens in your foot. Okay, so peripheral vascular disease results from narrowing of blood vessels, increasing the risk for reduced or lack of blood flow in the legs, and feet wounds are likely to heal slowly, contributing to gangrene and other complications. So this gangrene are reasons because of neuropathy as well as because of the high blood glucose in the blood. So these are the major complications of diabetes. I hope you are all clear, okay, with the major complications of or the chronic and acute complications of diabetes mellitus.